You know that feeling, right? Waiting for really important health news,
Yeah.
maybe from a scan or an x-ray, and it just feels like it takes ages because the information is just so complex to sort through.
Oh, absolutely. It's a huge challenge in healthcare.
A massive hurdle.
Yeah, I mean, looking at something like a chest x-ray, that takes immense skill, immense focus, and clinicians are often under, well, tremendous pressure.
Our workloads are huge.
Exactly. So pulling out all the crucial details accurately and quickly, that's demanding work.
And that exact challenge, that's what we're diving into today. How AI, artificial intelligence, is starting to step in and, lend a hand. We're focusing specifically on some news out of the UK. From Leeds Teaching Hospitals, NHS Trust, they're actually putting AI software to work interpreting chest x-rays.
Yeah, and their stated goal is really clear. It's about speeding up diagnosis.
Okay.
And not just in general, but for conditions where time is really critical. So things like lung cancer, acute infections.
Serious stuff.
Very serious. And even practical things like checking if feeding tubes or breathing tubes are in the right place. That's vital for patient safety.
So this deep dive, we're going to unpack the specifics of this AI rollout in Leeds. And we're sticking strictly to the source material you gave us.
Right. Just the facts from the source.
We'll explore how this AI is meant to function as a kind of co-pilot for the doctors.
And by the end, you, the listener, should have a really solid grasp of the key takeaways from this specific example. It's a glimpse into how AI is being used right now in a really critical healthcare area.
How diagnosis might be changing out.
Potentially, yes.
Okay, so let's get into those specifics then. The source mentions Leeds Teaching Hospitals NHS Trust is. Well, it's busy. Really busy.
That's putting it mildly. They process at least 135,000 chest x-rays every single year.
Wow, 135,000. That number itself just tells you something, doesn't it?
It absolutely does. It highlights the sheer scale of the task for the radiologists, the reporting radiographers, everyone involved in reviewing those images properly.
So much data.
So any tool, really, that can help manage that volume could potentially make a big difference to their workflow.
And the tool they've brought in is this AI software. It's described, as we said, as a co-pilot. And here's something that jumped out from the Trust's announcement. It can spot up to 85 different findings.
85, yeah, that's quite a range.
And it does it within minutes.
And that's really the core idea here, isn't it? It performs this rapid, comprehensive initial scan, flags a whole spectrum of potential issues very quickly.
Designed to process the image fast and just highlight things that need a closer look.
Precisely. Points of interest.
So how does that actually change things on the ground in the diagnostic process? Dr. Famid Chowdhury, who's a consultant radiologist and the clinical lead for this AI project, he talked about the main benefits.
He did. He outlined sort of two key advantages they're seeing or hoping for.
Okay, what are they?
Well, first, for the x-rays that do actually show something abnormal, the AI flags them, marks them as abnormal reads. And the goal is that these flagged x-rays will then get reported more quickly, basically fast-tracking them.
Which makes sense. If it looks like there's a problem, you want that information sooner.
Exactly. Speeding up that path to treatment, especially for patients who, might need it urgently, like with lung cancer.
Yeah, getting those patients diagnosed and starting treatment faster, that's obviously a massive potential win.
Huge. And the second point he made, maybe less dramatic but still really important, is about the x-rays that look normal.
Yep.
The AI can also help confirm these normal reads. Dr. Chowdhury mentioned this gives peace of mind.
Ah, right.
Peace of mind for the patients, obviously, but also for the clinicians caring for them. Just getting that quick confirmation that everything seems okay, that's valuable too.
Definitely. Reassurance is such a big part of healthcare, isn't it?
Yeah.
Just knowing quickly if there's nothing immediately worrying can take away a lot of stress.
A huge amount of anxiety, yeah. It's valuable information either way.
And this Leeds project, it's not just them doing their own thing in isolation, is it?
No, that's a good point. The source mentions it's actually part of a bigger regional collaboration. It's called the Yorkshire Imaging Collaborative.
Okay, so a network of hospitals.
Exactly, working together on imaging initiatives. And it's got significant backing, too. It received funding from the NHS AI Diagnostic Fund.
Ah, so there's dedicated money for this kind of thing.
Yeah, that fund allocated £21 million across 11 different imaging networks in the country. So Leeds is part of that broader push.
That level of funding and being part of a regional network, it suggests this isn't just some tiny experiment. It sounds like part of a wider NHS strategy to explore AI in imaging.
I think that's fair to say. It definitely points towards a more systemic approach being looked at.
They also shared a specific example, didn't they? From a pilot phase at Leeds. Dr. Chowdhury mentioned something.
Yes, he said the system had already, and I quote, proved its worth, even though it only launched recently.
Okay, what happened?
Well, he described seeing at least one example myself where at initial first pass, you may not have seen the abnormality, but the AI highlighted it straight away.
Wow. Okay, so the AI caught something a human might have missed on that first quick look.
Potentially, yes. On that initial pass, it acted like like a second pair of eyes.
That really underlines the potential, doesn't it?
Yeah.
The AI as a kind of safety net.
It certainly highlights how it could assist, especially given the pressures and the sheer volume of images we talked about earlier.
Catching things that might slip through when people are rushed or tired.
That seems to be the idea.
But, and this seems really important, despite that capability, Dr. Chowdhury was apparently very clear about one thing.
Yes.
He doesn't see this AI replacing doctors.
No, absolutely not. He was quite firm on that, according to the source. He sees it purely as a tool for clinicians to work with them.
He used that analogy again, didn't he?
He did. The AI is a co-pilot rather than a pilot. It's not flying the plane.
The doctor or the trained healthcare worker is flying the plane.
Exactly. The AI, he said, sits next to them and supports them in doing that job.
So that model AI supporting human expertise, enhancing it but not taking over, that seems absolutely central to how they're implementing this in Leeds.
It really defines the relationship they're aiming for. The AI does the rapid scan, flags things up, but the final decision, the interpretation, the responsibility, that stays with the human expert.
And you'd want that, wouldn't you? Especially in something as critical as a medical diagnosis. That human oversight feels key.
It seems that finding the right balance between leveraging the AI's speed and analytical power while retaining essential human judgment is precisely what they're trying to achieve.
Okay, so if we zoom out a bit now and just summarize this specific deep dive into the Leeds project, what are the main takeaways based purely on our source?
Well, I think first, the core function. This AI acts as a co-pilot. It rapidly scans chest x-rays, identifies a whole lot of potential findings up to 85, remember, very quickly.
Right, speed and breadth of initial analysis.
Then, the intended benefits they highlighted. Getting those abnormal x-rays reported faster, hopefully speeding up treatment.
And providing quicker peace of mind when the x-ray looks normal, reducing that anxious waiting time.
Exactly. But maybe the most crucial point, the one emphasized repeatedly.
The co-pilot point.
Yes. That the AI is explicitly a support tool. It's not making the final diagnosis. That call, as they put it, still rests firmly with the trained doctor or healthcare professional.
It's human expertise, but augmented by AI, helped by AI.
Precisely. Augmented, supported, assisted, but not replaced.
So, thinking about this now, for you listening, maybe consider how this specific approach, this focused AI assistance could change things. Like a diagnostic experience you or maybe someone you know has had.
Yeah.
It really highlights how catching something important faster, like in that anecdote Dr. Chowdhury shared, where the AI flagged something initially missed, how that could genuinely impact patient outcomes.
It's a practical example of AI designed to enhance what humans do, particularly in complex, high-stakes tasks, rather than trying to automate it away entirely.
Which brings us to a final thought, something for you to maybe ponder on your own. If AI is showing its value here as this co-pilot in the really complex job of reading medical images.
Helping human experts by rapidly analyzing and flagging things.
Right. Where else could this specific model, human expertise being directly and significantly supported by AI analysis, aim squarely at improving speed and accuracy? Where else could that model be most effectively applied? What other fields face similar challenges?